So thank you very much for being the host, Margus Arm from Tahik. You are the developer of the eHealth portal services, and you gave us an overview of the past and what's coming now with the new patient portal. But now you're working on the future, and today is a very special day because there's going to be some new product. What is going to be launched? What kind of plan is being launched today?
Hi, yes. Today we have one conference. It's like finalizing the project about personalized medicine. It means that there is a genome-based analysis and all the technology on top of that we can provide the information to the doctors.
So there's these 200,000 people who are in a bank and they have geo markers.
Yes.
And that data is now available. But now that's also going to be available to the professionals in the healthcare sector to help the patient.
In the side of the technology, yes, it's available, but not in the legal process, not yet.
Yeah, okay, so the data is there, the technology, your support is there,
yes.
And what is missing?
What is missing? The legal side is missing, like a consent to use that kind of information for that kind of services.
And I understand if the pressure is high, you change the law in a weekend.
Not this time.
Not this time. How long will it take?
This time will take time, and we have a prognosis that it will happen beginning of the next year.
Is that because it's politically controversial, or is it because of the new parliament?
I think that politically difficult topic, and it will take time to prepare all the things in the right way.
And does the patient have to give consent to use the data for the GP or the hospital to use it?
Yes, we have a consent service, and the citizens, they have to give the consent to use the information.
Is this an exciting new project? Is this really, or is this just a small project in your view?
Sure, it's an exciting and interesting project. We have seen some demos and information that the doctors can get about that and give the like a support idea not to the customers what they have to do or what are the risk elements toward that kind of diseases.
Yeah, and they can give much better personal advice because of that data. And
yes.
You're sitting on the data, your platform is ready, the university works together, but you just have to also wait for legal.
Yes.
Okay.
Okay, some tests, and we have still the time for the testing and be more ready for the final launching or opening the services.
Today is also an interesting day because the Portal 2.0 has been launched this month. Huh?
Yes.
It has launched?
Yes, all the citizens in Estonia, if they go to the old digilugu.ee portal, they can see already the button, please go and check the new version of the patient portal. It's just 4 different services which is opened in the new portal, but still it's open. Yeah.
And what is the big difference between the Portal 1.0, which is 10 years old and document-based, and Portal 2.0?
The last version of the portal was launched or developed 14 years ago already. The main difference is the UI or user interface. It's more convenient and more like a customer-oriented solution. You can get better information and views and.
It was a bunch of PDFs.
Yes.
and also who accessed that data. That was thing. What is now nice for the patient to do in Portal 2.0?
It's how to say, the better user interface. You can get access in a better way, and we do not implement the new services at the moment. We are just taking old services from the old portal to the new portal.
Yeah, you have a $40 million project budget for all the services, for social services, e-health and labor. How much do you spend on the e-health services per year? That varies, but approximately.
It was public information that when we started the new patient portal, the budget was 1.5 million.
1.5 million?
Yes. In the beginning, to close the old one and open the new one. And if you want to build up a new services, then it will increase, but like a renewal of the old portal is 1.3 million.
Why so low? I mean, how can you do it for such a low amount of money?
It's for us. It's not so low money. It's quite a big amount still, and we are. I don't. Yeah.
Yeah. No. So you're very.
we manage in some way.
Yeah,
but this is maybe it's not 1.5 million. It's just the money for the development, the code. It's not our salaries or governmental salaries. It's not included.
Yeah, is it is more the external cost of building
external
it
cost
somewhere?
to build and order development.
Okay.
In Estonia, we don't have our own developers. It's outsourced through the public procurement process.
Yeah. One of the next thing is also interesting, I know you have to go, is AI. Whenever you already have AI triads in the first line, but what do you think of that development?
Yes, AI is very hot at the moment, but we do not have AI in that kind of at the moment in the production. But we have how to say, different components where information system will start activities. In old way, it was like the medical data was sent or activated by the doctors.
Yeah.
At the moment, we have information systems which looks the activities, and based on that, they can start the next activity.
Okay, so you're monitoring all the transactions, and from that you come up with through AI. You basically predict what's going to happen.
I think,
it's
but
machine
it's
learning.
A machine.
It's
maybe
machine
it's
learning.
some processes. If something happens, please do next thing. It's like more like a program, reprogrammed.
Okay, you have been in the private sector with the banks. You've been in the public sector. You have now. What do you think for the future? Is it going to be an exciting new developments, or is it going to be slowly progressing?
Yes, I think the very interesting times is coming because our new government told that they want to have a personal state. What does it mean? We have to think out that. That means that most of the services, they should be more personalized and based on my information, based on my income or activities, and how to implement it. It's interesting.
Okay, thank you.